This is Dr. Sonia Dhoot, and you are watching this video today because you have been diagnosed with wet macular degeneration. Wet macular degeneration is a condition that happens in people in certain families, and the chance goes up as you get older. But you have new blood vessels that are growing in your macula, which affects your central vision and is causing your vision to be blurry or distorted. The way that we treat wet macular degeneration is with injections into the eye. This sounds really awful, but we do this all the time in the office and is something that is very well tolerated. The eye gets numbed over the course of about 2 minutes, so by the time we administer the injection, it is pretty painless. Some people do feel a slight bit of pressure, but they should not feel any pain with the injection. The injections are a treatment, not a cure for wet macular degeneration. And what that means is they work very well, but they need to be administered continuously. How often they need to be administered depends based on each patient and each eye. We start the injections once a month, and then once the fluid and the hemorrhaging resolves, we see how long we can extend out the amount of time between the injections without things getting worse. It is a little bit of a trial and error process. The average for all people in the country is about every 6 weeks they need injections. There are a few different medications we can switch between. So if your eye does not respond as well as we'd like to the first medication, there are other ones we can switch to. The longest we go in between injections is about every 12 weeks, so about 4 times a year, although most patients don't make it quite out this far. The biggest risk of injection is the risk of an infection, which happens in about 1 in 2 to 3,000 people. So pretty rare, but that's the thing we watch for most closely. Because of that risk of infection, we recommend you keep the eye clean for the first 5 days after injection. That means no getting water in the eye, no sleeping with any pets, and just trying to make sure you're extra clean if you're touching around your eye area that's gotten the injection for those first 5 days. For the first 24 hours after the injection, the eye can feel very scratchy. So for those first 24 hours, we do recommend you lubricating the eye very much. So every 30 minutes to an hour for the first couple hours after the injection. After 24 hours, however, you really should not be noticing too much discomfort. And if you do, please give us a call. I tell patients if you can go home after the injection and take a nap, you usually wake up feeling better. The white part of the eye can be very red after the injection, which is also normal, and you may experience floaters after the injection as well, which can also be normal.